These videos are meant to be used in conjunction with formal in-person photographer training and should not be used as a primary resource in the training of proper use of retinal cameras. This video may be used freely for nonprofit educational purposes with the expressed acknowledgement of the University of California, Berkeley. Use for any other purpose requires written consent from the UC Berkeley Optometric Eye Center. This video is copyrighted by the UC Berkeley School of Optometry 2012. This video will instruct you in how to take external photos for upload to IPACS with each patient case. Although a majority of retinal cameras are not designed specifically to take external photos, most cameras are able to do so with the proper settings. The external photos provide the consultant with information about how clear the light path is into and out of the eye. If the patient has a cataract or some other pathology obstructing the light path into the eye, it will have a major impact on the ability to obtain good photos of the retina. You may be able to capture some details, but the overall picture quality will suffer. Examples of different obstructions are shown here. If there are no obstructions, the light will reflect off of the retina and give you an even reflex as seen in these photos. This is the same as the red eye reflex that you see in flash photos of people, only in this case, it is the desired effect. These two examples also illustrate that the reflexes can be different in color from individual to individual. We will now go through the proper setup and technique for taking external photos on a Canon CR-DGI retinal camera. If this is not the model of camera that you will be using, many of the features will be similar. Please consult your manual or contact your camera manufacturer for instructions on how to set up your specific model for taking external photos. The first step in the process is to align the patient properly in the chin rest. First, instruct the patient to place their chin on the chin rest and their head all the way forward against the headrest. The patient must be aligned properly in the chin rest to obtain good photos. As you can see here, the patient's eye is below the white canthal marker and therefore the chin rest must be moved upward to properly align the patient. Using the collar under the chin rest, raise or lower the patient's chin until the corner of their eye lines up with the white marker as shown here. The ideal external photo will have several features. The lid margins and lashes should be at the edge of the photo with the eye taking up approximately 2/3 of the total area. The iris should be in the best focus possible. The lashes and lid margins are at the edge of the photo and slightly out of focus. Once the patient is properly aligned in the chin rest, the first photo taken will be an external photo of the right eye. Using the collar and the joystick, move the camera to a position where the eye is approximately centered in the monitor. Engage the auxiliary plus lens on your camera system. On the CR-DGI, pull the slider on the right side of the camera all the way out. As you can see, the image of the eye becomes blurry, which is normal. Instruct the patient to look straight down the barrel of the camera. For example, if the patient is looking off to the side as shown here, you are unable to see most of the reflex within the pupil. Pull the camera all the way back using the joystick and press the alignment button. The view will change to a much more magnified view of the front of the eye. To obtain good focus, you need to move the patient's head back slightly. The easiest way to accomplish this is to bring the height of the power table up until there's a small gap between the patient's head and the headrest as shown here. You will see the eye move slightly backward in the monitor. Using the focusing knob, focus in and out to where the iris details are as clear as possible. Once the iris details are in focus, press the shutter button on top of the joystick to take the photo. Here is the resulting image of the external field of the right eye. Again, note good focus on iris details and that the lashes and lid margins are at the edge of the photo and slightly out of focus. Move the camera directly to the right so that it is positioned in front of the patient's left eye. Again, the image in the monitor should appear blurry. Because the vertical alignment is already set from the previous eye, any adjustments will be minor. Instruct the patient to look straight down the barrel of the camera. Press the alignment button, which will present a more magnified view of the eye. Once again, use the focusing knob to focus in and out such that the iris details are as clear as possible. When the details are in focus, press the shutter button on the joystick to take the photo. After taking the photo, instruct the patient to close his or her eyes to help the pupils redilate in preparation for internal field photos. The resulting image of the external field of the left eye is shown here. Once again, note the focus on iris details and that the lashes and lid margins are at the edge of the photo and slightly out of focus. To set up the camera for internal field photos, bring the height of the table back down so that the patient's forehead touches the headrest once again. Remove the auxiliary plus lens by pushing the slider in. To do this will vary by camera model. If you have any questions about any of the procedures shown in this video, please contact UC Berkeley Digital Health or IPAX.